Well, I mean, imagine, if you're a patient coming in for a test, if you think you've got cancer, everybody's very worried about that. There's going to be a delay now. It's because you're going to have to come in, you make an appointment, you've got to go and find a time in your diary and a time that corresponds with the pathologists and the guys that take the samples. You've got to come in and have a biopsy, a solid tumor biopsy usually. That will typically be a needle biopsy. Sometimes it's a resection. It's a major procedure sometimes, or if it isn't a major procedure, at the very least it's inconvenient. And sometimes it can be actually dangerous. And there are times when we don't even want to take those biopsies because of the risk. So it's a less risky process to have a blood sample, much easier to have a blood sample taken, not painful, very quick. We're all used to having jabs now, so having a little bit of blood taken, I don't think many people object to that. The utility of it is very high. We get a very high success rate from those tests. So I think most people, given the choice, would choose to have a liquid biopsy wherever they could have one. The question does become, if we get a negative result with that, what does that mean for the patient? Do we then have to do a biopsy anyway? And we may have to do that. But for at least 2/3 to 75% of patients where we take liquid biopsies, we get a clear answer straight off. So I think the majority of patients would want it. And in a minority of cases, it even enables testing where we wouldn't be able to do it before. The science is really good now. We can see there's excellent correlation between what you see in a liquid biopsy and what you see in a solid biopsy. So it speeds up the testing for patients. It actually lowers the cost because those samples don't necessarily have to go through a histopathology lab if we discover a variant that's actionable straight away. And it'll get those patients quicker treatment with less intervention. So I think, it's a win-win all round. For patients. And it also means that the kind of tests that we're putting together are pretty comprehensive. So it won't be a case anymore where we're just kind of guessing what the most likely target is. The test that we'll run will pick out all the major targets that are actionable in one go, super rapidly, and we'll be able to get those patients onto treatment as fast as possible.